Okay, so in terms of risk factors, it's really important to understand these. So, risk factors are variables that increase the vulnerability of an individual or a group to an illness or accident. So, we have modifiable, non modifiable, modifiable, and environmental risk factors. Non modifiable risk factors are things such as age, gender, genetics, and family history that cannot be changed. Modifiable risk factors are lifestyle practices and behaviors that can be modified, such as poor nutrition, overeating, not getting enough sleep, stopping smoking. Those are things we can change. You cannot change how old you are. You cannot change those non modifiable risk factors. Modifiable, we can change. And then environmental factors, that's where we live. Is there a lot of pollution? Are we able to access the things we need to access? So, risk factor identification and changing health behavior. So, we learned all the things that make up health. Let's talk about when we actually want to implement education and help our patient change. So, the trans theoretical model of change is an important thing to be aware of. So, the trans theoretical model of change talks about where somebody is within the process of change. So, change is not a linear process. People often will relapse and recycle through these stages. So, let's talk about these. So, pre contemplation, the person has no intent to make a change and it's within the next 6 months. The person has no intent to make a change within the next 6 months. They're not even thinking about it. Contemplation, the person is considering making a change within the next 6 months. They may be kind of ambivalent, but say maybe I have a problem, I need to work on it. Next is preparation. This person is making small changes in preparation for a change within the next month. So I'm going to quit smoking next month, something like that. They may have tried to change in the past, but here they're actually doing that preparation. Next is action. This is where we're actually doing something, committed to change. We're quitting smoking. And then maintenance, this is sustained changes over time. It begins 6 months after the action has started and continues hopefully indefinitely since we're getting a good behavior. So pre-contemplation, not thinking about it. Contemplation, thinking about it a little. Preparation, doing things to make the change. Action is where we're doing the change, and maintenance is where we're keeping that change going. In terms of illness, so illness is a state in which a person's physical, emotional, intellectual, and social and spiritual functioning is diminished or impaired. So illness is where we're having an impairment in any of those. We have acute illness and chronic illness. So acute illness is typically reversible and has short durations. The symptoms appear abruptly, are intense, and subside after a relatively short period. Next is chronic illness. This typically lasts longer than 6 months. It's irreversible and affects functioning. So Sally has decided to set aside 30 minutes a day to walk after work next week. Sally is in what stage of risk factor modification? So she's decided to set aside 30 minutes a day to walk after work next week. What stage of risk factor modification? So she is in preparation. She's preparing to make a change. Next, we'll talk about illness behavior. So illness behavior involves how people monitor their bodies and define and interpret their symptoms. So people who are ill often adopt cognitive, affective, and behavioral reactions that are influenced by sociocultural and psychological factors. We have some variables here that influence illness. So we talked about variables influencing health. Now we're talking about variables influencing illness and illness behavior. So internal variables, these are the person's perception of their symptoms and the nature of illness. External variables are things like visibility of symptoms. So can other people see their symptoms, their social group, cultural background, economic variables, accessibility of healthcare, and social support. The impact of illness on the patient and the family can be significant. Illness is never an isolated life event. A patient and family deal with changes resulting from illness and treatment. Each patient responds uniquely to illness, requiring you to individualize nursing interventions. The patient and family commonly experience behavioral and emotional changes and changes in roles, body image, and self concept in the family dynamics. So, behavioral and emotional changes, people are reacting differently to illness or the threat of illness. Individual behavior and emotional reactions depend on the nature of illness, a patient's attitude towards it, and the reaction of others to it, and the variables of illness behavior. Impact on body image. This is how somebody perceives their own body. Depending on what's going on, it can result in quite a bit of change to body image. Impact on self-concept. Self-concept is a mental self-image of all aspects of your personality. Self-concept depends in part on body image and roles, but also includes other aspects of psychology and spirituality. Next is the impact on family roles. People have many roles in life, such as wage earner, decision maker, professional, child, sibling, or parent. When an illness can occur, people try to adapt it, but if that role is lost, it can create a change in the whole system. And then impact of family dynamics relates to impact of family role. Family dynamics is a process by which the family functions, makes decisions, gives support to individual members, and copes with everyday changes and challenges. Family dynamics will often change because of effects of illness. So you can kind of reflect, think about a patient or a family member who recently experienced a change in health status. How did that change the entire family? And last thing to talk about is caring for yourself. This is very important when you are a nurse, but also right now. So things to note, make sure you're eating something healthy. Try to get some fruits and vegetables in. Try to get sleep. We love like 8-9 hours. Sometimes it's less, but try to get as much as you can. Do some exercise, get up and walk around the block. Have that good work-family balance. You can't work 80 hours a week. Sometimes you might need to financially, but really having that good balance between things you enjoy and things you have to do is really important. Get some coping skills. I like deep breathing, going for a walk, hanging out with good friends, watching a funny movie. Those are all things that can help kind of manage when you're having a really bad day. Allow time for personal grieving. If something changes, allow yourself to grieve and feel sad. Focus on your spiritual health if that's important to you, and find a mentor when you're at work. You need somebody who can help support you.